Hey, good evening, ladies and gentlemen. I'm Dan Conley, the Commanding General of Marine Corps Installations West and Marine Corps Base Camp Pendleton. I'm here with Sergeant Major Matt Hackett, the Sergeant Major for MCI West and Marine Corps Base Camp Pendleton. First off, thanks for joining us. I know you got a lot of things in your mind. I know there's a lot of stuff going on, so I appreciate you taking the time today to join us. I'd also like to thank you for the pages of questions that Matt and I have today and that are on some screens around here that we'll be walking through. So the idea is we're going to start with some of these, and then as your questions come in, we'll start to answer those as we can. If we run out of time today, we'll figure out another way to get at this stuff. Matt, anything you want to add?
No, the only thing I'd like to add is that we realize what you're all going through, and we're experiencing it as well. I said earlier that we both have families of our own. This is a team effort. This is a family effort, and we all have to work together.
Okay. The first question is a social media question from John Carter. He asked, when is the base going to address the decision made by the governor of California last night? Sergeant Major and I put out a public service announcement today. We have started to address our response to what the governor put out. The bottom line is the shelter in place or the stay at home directive that the governor of California put out today exempts the military because we still have a national security mission to execute. So the Marines and the sailors and the civilians that work on board the base, whether they're MCI West, Pendleton, or MEF Marines and sailors employees, are still here and working to accomplish that mission. We try and link up or sync up as much as we can on the California governor's directive, so we're not going out in town as normal. We are following those, but when it comes to working here on base, we continue to execute the mission. And I would add, in places like MCRD San Diego, at some of our chow halls across our installation, those mission essential people can include the folks that are working in those chow halls because they are all part of making this place run. So the reason that we don't do everything the exact same way that the California governor directed is because we have a national security mission to execute.
And I would offer as well that the Commanding General for 1st Marine Expeditionary Force has directed that his Marines that do live off base, when they're not at work, that they adhere to the governor's directives.
Jocelyn Batalis, I apologize if I get your name wrong. Jocelyn Batalis from social media asked, why hasn't Camp Pendleton followed the protocol of self-isolation yet? We do. Marine Corps, Camp Pendleton, the bases across this region do follow the CDC's guidance. That doesn't mean that everybody automatically self-isolates. The direction that we have given the Marines, the sailors, the civilians, and the family members that are here are if you have any of those symptoms that the CDC says are indicative or potentially indicative of COVID-19, that you go and seek medical attention. I would recommend you start with the nurse hotline and describe those. And before you go down to the Naval Hospital here at Camp Pendleton, you call ahead so that they can accurately and adequately receive you. Once you are tested on board Camp Pendleton and across the rest of the Marine Corps, you are put into what's called a quarantine status. So you can go back to your house and quarantine there. You can go to your barracks and quarantine there, awaiting the results of your test. You're supposed to isolate from the rest of the members of your family if you're married out in town or here on base. And if you're in your barracks room, you're supposed to isolate to yourself. If you have a barracks roommate, chances are they ought to get tested too. Once the tests come back, if they're negative, then you are returned and you are not positive. If you are tested as positive, on board the base here, we have the method to isolate you then from the rest of the population. Additionally, any Marine, sailor, civilian that's coming back from a deployment, we follow the direction from Headquarters Marine Corps, which is those folks will go into a quarantine for 14 days. So they are put into their rooms or they are put into their barracks rooms at homes and they are expected to self-quarantine. That puts the onus on the individual to follow the direction. We make sure that the command still has the ability to feed those folks and provide them medical care, but we are following the direction of how to self-isolate and self-quarantine and to isolate. Anything I missed?
And the one thing I'd add is our emergency services on Camp Pendleton have asked if you have symptoms and you want to go get checked out, if you are able to, you self-transport yourself.
Richard Caleb Weiss asks, is there any word on if base is going to be locked down, like no in or out movement? Mr. Weiss, no, there is no word on that because there is no plan for that. As I mentioned earlier, we still have a mission to execute. Regardless of the status of this disease, that mission doesn't go away. So there will always be people coming and going from this base, particularly because it takes a pretty big staff just to run the base. Being the kind of city that it is, we need to make sure quite literally that the lights are still on, the water still flows, the sewage goes out, and we're still able to communicate with the rest of the world. So at no point right now is it projected or planned to close the gate and stop all movement in and out. Anything? Okay. Laura Noble says, it seems like our Marines aren't following CDC guidelines when going into work. Social distancing isn't happening as it should. Even the gyms are still open. I understand work still needs to be done, but our Marines are going into work and not following guidelines is potentially putting all of us families at risk. I apologize, Ms. Noble. I think I'm probably reading this later than when you sent it, but our gyms are already closed, and we are following the guidelines. I will admit to you, and you can see from the camera, I'm closer than 6 feet to Sergeant Major. It's only because I'm on a camera. But as we're going through our workspaces, we do try and maintain a 6-foot distance. Cough into your arm. Wash your hands for 20 seconds. Down to the lowest level, we were trying to push that to all leaders. Does it work every time? No, because we're not perfect, we're human. But we are at the leadership level pushing that down, and that includes down to the platoon and squad leader level.
Yeah, I haven't shook a hand in quite a while, so.
Megan Catherine Fulton asked, if San Diego County shelters down, do we have to shelter down? Also, why are rules different off base than on base? They're different off base than on base because we're a federal entity and we have to execute the mission that we've been given. So that's a state. And as far as shelter down, I think it's appropriate to think about what the governor is trying to do and see how it applies here. So he's trying to he's directed that at least in San Diego County, the county government has said you'll have no more than 10 people. And that's to try and disperse people so that we're not gathering in large groups. We do the same thing here. The number here is 50 because that's the size of a platoon. And within a platoon, you can push that distance out. You can tell the platoon, okay, go to double arms intervals so that you have 6 foot all around. As far as sheltering down, again, we're not sheltering down, but we are telling people that if you don't need to go out, well, you can't go out in town unless it's for groceries, gas, medical appointments, medicine, those kind of things.
And I would add as well, I mean, the same establishments that are open out in town are open on base. We don't have a lot of the bowling alley is closed, the golf course is closed, the paintball park is closed, our beaches are closed, and all of those other facilities like that are currently closed. And like I said earlier in the earlier video, our lodging is still open, our commissary is still open. Of note, the commissary is routinely getting its shipments as scheduled, and our exchanges are open.
Casey Jensen on social media says, Camp Lejeune is at HP Con Bravo in lockdown, basically with people restricted to barracks or their homes, when there is one confirmed case there that has been disclosed. Pendleton has many cases, more than have been disclosed to the media, yet everything remains the same. My husband goes to work every day in close quarters and brings anything he is exposed to home to me, and I am pregnant. California has mandated stay at home for everyone except essential personnel. Why isn't this being heeded? When will Camp Pendleton take more aggressive steps to flatten the curve? I think there's a couple different things in here, and if you'll give me a minute, I'll try and get to them. Yes, Lejeune is at HP Con Bravo, and so is Camp Pendleton and the region, MCI West. There are not many cases at Camp Pendleton. As of this afternoon, when Sergeant Major and I walked in here, there was one at Pendleton.
Well, there was two cases on Pendleton that were tested, but neither one of those individuals actually were stationed on Camp Pendleton. One was a retiree from out in town that came onto Pendleton and got tested, and the second one was a Marine from Miramar that was up here conducting training.
To your point with it, everything remains the same. I don't know that I would agree with that. If you go to the MCCS homepage, they'll show you all of the places that are closed. As I mentioned before, all the gyms are closed. All the restaurants on board the base are following corporate guidance, and they are takeout only. We have the CDCs are still open because families still need to drop off their kids at CDCs. And we'll continue to track that until or unless there is an outbreak, and we'll deal with it, or until that population drops off and we don't need the CDC to be open. Other recreational facilities like the golf course and the stables are closed down because they're not mission essential right now. So in that sense, I don't know, I don't mean to make too fine a point of it, but I don't think everything remains the same. If your husband is going to work and you're concerned because you are pregnant, I empathize with you, and I would strongly suggest that he call his chain of command and explain what is going on. One of the discussions that Sergeant Major and I have had discussions about a lot is with regard to this virus and people being at home with someone that may be in a vulnerable state. I don't know that being pregnant is vulnerable to this disease, but I'm not going to argue that point. But if you do have an EFMP family member, or you have a parent that's over 65 that's living with you, I think it's very worthwhile for the service member, Marine, sailor, to call their chain of command and explain the answer. Personally, on our staff, we have people that have some of the folks that are in those categories. They are not sick. No one in their family is sick, but we have still told them to telework from home or to stay home because I don't want to hazard their family by them going out and coming back in.
And I would offer for the CDCs, they're taking extra steps to make sure that they're sanitizing their spaces in there, to make sure that the children are safe in that environment. As well, they're asking all the family members, if their child does have a fever, not to bring them into the CDC.
Linda Aiello on social media says, we're a DoD family located off base, so is it safer to stay on base or at, I think that meant, or off at this point, I'm sorry, or off. So is it safer to stay on base or off base? I don't think it is inherently more dangerous to stay anywhere. If your question is about, should someone in your family become positive, I think you would be more comfortable quarantining at home. And I think the obligation we then have, the chain of command has for a Marine sailor that's out in town is how do we support them in that? We're fortunate to have good neighbors that, stop by and say, hey, do you need something? If you don't have that, there are still delivery services for food. Or we can go to what happens a lot of time when you have somebody has a baby in the unit. You set up a chow run schedule and people sign up to say, okay, now it's time to bring groceries out to the family. I think there's a number of ways we can get at this. I don't think being on base is dangerous or out in town is dangerous. I think if you're a positive, personally, if I were positive, I think I would want to convalesce in my home where I have all of my stuff, and I'm probably going to be more comfortable than coming on base and trying to convalesce.
There's no telling how long this is going to take. I mean, at some point, you're going to have to go out and pick up some essential items that you're going to need, whether you have children that need diapers or whatnot. And the goal there is that you're just practicing the safe distances, as much distance as you can from other people, and make sure you're washing your hands and utilizing hand sanitizer when you can.
There's an ICE comment with no name that says, what are you advising individuals to do if they believe they have the virus? My first recommendation to you would be to contact the helpline. We'll make sure we get that number that is posted up on the website and call in and explain the symptoms that you have. You may have COVID symptoms, or you may just have a disease or a funk or something. I don't know. But call and find out. If you think you need to seek medical attention and you want to go to the Naval Hospital, I'd recommend you call ahead of time and let them know you're coming in so that they can be prepared to adequately receive you. If you have any doubt at all, I think you should call your chain of command and ask the question or explain the symptoms or the circumstances of what you have and ask them for guidance. I think if you are diagnosed, that you should follow your provider's recommendation to stay at home to get through this virus.
Yes, seek medical attention and notify your chain of command. That's a huge step in the process, just keeping people notified of what's going on with you.
Robin V. White on social media asked, will the Marine Corps units shift focus with medical being tasked to respond heavily to the pandemic? The naval staff that we've got, the medical staff that we have, first and foremost is here to take care of the Marines and sailors so that they can execute their mission. If we are tasked to support pandemic support, let me back up a step. we have been tasked to support pandemic support. Just about 2 months ago, the Marines and sailors down at Miramar were tasked to support Health and Human Services and the Centers for Disease Control in the evacuation of American citizens from China. They stood that process up. HHS and CDC did the reception, they did the housing, they did the care, and they did the repatriation of those Americans once they got here. After about a week off, after that was complete, Miramar stood down for about a week and then stood it back up with a new team from Health and Human Services and the Centers for Disease Control in order to receive receive Americans off of the Princess Cruise Lines. We are probably halfway through that mission right now, and we'll continue to execute it as long as possible. So in that sense, Marine Corps has already responded to how to get at this pandemic disease. Should it go larger, and I don't know what it's going to. I think you'd have to ask an infectious disease person. But if we are tasked to do something, we will respond within the tasking that we have. Josie Fisher on social media asks, how can we sign up for notifications if our service members are deployed and we don't have CAC at home? Could we have FRO, URO assist families who need this? That's a great question. I think our deployment specialists are the first and best step for that. I think the second thing is the websites for Camp Pendleton, for MCCS, and then for the units in order to contact those folks. Okay. Bruce Kerry Austin on social media asks, how will the families of Marines know if their Marine has been or will be tested for the virus? The protocol right now is to test Marines and sailors and civilians who evidence some symptoms. So Marine, sailors, civilians, just by virtue of being here, don't get tested for the virus. It's not until they display some sort of symptoms. So if your Marine, sailor, or civilian has the symptoms, get them tested. Until then, that is not the protocol.
And the only thing I would offer there is there's a number of comments that are out there that suggest that the only people that the Camp Pendleton Hospital is testing is those going overseas. And that's just not true.
There's another ICE comment, no name. Why did you close the gyms? Because we want to make sure that we have the ability to clean them appropriately and that doesn't become a vector to spread this virus. We're working with the MCCS directors, we're working with the camp commanders at each one of those locations to develop the protocol so that we'll be able to clean them. Until we get through this virus, I don't think it's appropriate, and that's the reason why I closed the gyms, to just leave them open. If we can develop a protocol that allows us to deep clean them, we may reopen them on a reduced basis, balancing the needs of Marines, sailors, and families to go in and get a workout versus the needs of making sure we do all that we can to interrupt this virus. I'd also add, please don't confuse a closed gym with not being able to work out or PT. There are a number of websites, if you just go on the web and talk about and type in stuff like bodyweight exercises. Go to the Marine Corps website for functional fitness. There are a number of things that we can do here in the Southern California area to get a good workout that don't involve the use of a gym. Kelsey Burton on social media says, can EFMP families please have a set time to go to the commissary? Taking medical, fragile kids into the store right now is hard, but we need to go get foods as well. Man, that's a great point. I just went down and talked to the director of the commissary here at Camp Pendleton today. I don't control the commissary beyond just the fact that they're here on the base, but it's a point that I'll bring back to them. And I think in one of the other questions, somebody asked the same thing for elderly veterans, and there was another one for Marines that are on duty. So I can't answer your question right now, but I will promise you this. I will go back to the director here at Camp Pendleton and ask him whether he has the ability to reserve some period of time where it is EFMP families, or if it is elderly, or if it is Marines in uniform that are on duty. So I have that one as a takeaway, and we'll work that question.
just a side note on that as well. Just if you're going down to the commissary, make sure you bring your ID card. They're only letting individuals with an ID card into the commissary at this time.
Another ICE comment from no name. What is the status of teleworking at this moment? Why aren't more workers teleworking? Who is considered essential personnel to be working on base? I don't know where you work. I'll tell you, if you work at MCI West or Marine Corps Base Camp Pendleton, we have pushed telework to the greatest degree. I took the vast majority of the meetings that I have today outside of my office at different locations just to be able to telework. If you belong to another command that's not MCI West or Marine Corps Base Camp Pendleton, I'd ask you to talk to that chain of command. Part of this is also a limitation of the system to be able to absorb this much telework at one time. I'm not a communicator, I don't pretend to be, but there are going to be some delays, I suspect, given the amount of folks. But your point is valid in pushing telework.
And with that, you probably notice there's still a lot of traffic coming on the base. And with all of the things that are still open, like the commissary and the exchanges and the lodging, that still requires all of those individuals to continue to come into work. Keep them open.
Social media and Losgar asked, what happens to Marines currently on a MU overseas? My son was supposed to come home in May. Does that mean his homecoming will be delayed? Ma'am, I don't know specifically, but I will tell you that everything having to do with deployments, operations, and training is being discussed. Because there's a number of effects to it. Some folks have talked about ongoing training or training that's coming up. And while it may seem easy just to cancel the training that's scheduled, really the job of the leadership is to look further down the road to ask the question, were we to cancel or amend or delay something, what is the impact? So to your specific question about a MU overseas, all of that is part of the discussion. If that MU comes back, is there another one to go out? There's a number of travel restrictions, both from DOD and that come across from the leadership. So I would tell you, those questions are being asked. I can't answer your question specifically whether or not his or her homecoming will be delayed.
There were a lot of questions from mothers and fathers out there that live close to a military base that inquired about communicating or bringing something to their son or daughter. It's hard to answer that question like the general said because it's specific to each command, but we have been encouraging every Marine out there to communicate with their loved ones and communicate with their chain of command to get those answers, those questions answered quickly.
Social media, Caden, Michael, Anthony Hall, why are Victor units still being sent to large-scale training exercises, such as ITX, despite the supporting agencies like the Air Wing and Logistics Battalions dropping out? Again, I think those are being discussed, or I know those are being discussed. No one has dropped out yet. The final decision on what is happening with those exercises is still to be made. And again, it's not a question of just canceling the exercise. It's, were that to happen, what are the downstream effects in, say, 3 months, 6 months, a year, 2 years down the line, not only of that unit, but the readiness of the force. On social media, Jennifer McLaughlin Allen asked, any volunteer opportunities? Would love to help somehow. I think it's a great question. I think there's a lot of folks now that would be sitting around that don't normally, would not normally be on the base without something to do or out in town. I don't have any specific volunteer opportunities, and bearing in mind the governor's directive to no more than 10 people in essential travel, it's something that I've asked the staff to look at. Is there a way to link up the capability that we have, a population that is healthy and that may be able to help out, with a population that might need some help, say at an elderly citizen's home somewhere in town? Locally, if you are on base, I'd ask you, is there anybody in your neighborhood that needs help? Is there a mom or a dad deployed and the family is here that's trying to get through this thing? Can you help out your next door neighbors? One of the things I wish that we could show everybody is the response from the community for the initial round of COVID guests that was down at Miramar. Because when the base commander down there, Colonel Dockery, and his wife Erin made the comment about this is about helping out Americans, it put the focus back on what this should be, which is helping each other. And the response from the community, it wasn't overwhelming, but they had a whole lot of stuff, from cards and letters to just basic necessities flowing in to help the neighbors. So Is there a volunteer opportunity? No, I don't have one on base. I'm not aware of them out in town. But I would say within your local community, on your street, your cul-de-sac, your area, is there anybody around you that needs some help? I'd suggest that's probably a good place to start.
I would offer, if you're an EFMP on base on Camp Pendleton and you need someone to go to the grocery store, please contact me. I'm more than willing to help out and go pick up groceries for you and drop them off at your house, or I'll find Marines that are interested in volunteering to help you out in that way.
There's a social media question from Chloe Boots. For the Marines that are in training right now, are you going to send them home due to the virus getting so serious out in California? There are no plans right now. The training that is ongoing, or the training that's ongoing, is going. As these decisions are made, again, above my level, they will figure out whether or not we still need to execute some of the larger scheduled training that we've got going on. To get back to an earlier point, the point is, it is not because of the rampant spread of the disease out here that it's not rampant. It is community spread right now, but it is not to the point where we fear for the safety of the Marines and sailors that we have in training such that we have to send them home. All of the training is under review, as well as the movement of folks in and about the area. Nice comment from No Name. How will workers with children at home be compensated for staying home? Specifically, the Duluth Child Development Center. I don't know.
I don't have that answer for you as well at this time, but we'll look into that and post something on.
Yeah, as far as child development centers, we will keep those open as long as there's demand to keep those open. I probably need some more. So if you were the ICE comment on that, if you want to follow up, I'll be happy to try and work through that with our MCCS team. Tony Jamal from social media asked, what about the vendors working in MCX? What's the plan? I will defer to our MCCS folks. Check on their website to see what is going on with those. If there's a specific one that you're looking for, we can try and get you back an answer. Social media, Anna Dash says, how can we get official information regarding the CDCs on base? I'd refer you back to MCCS's webpage. They update that pretty frequently. And I think calling there is probably appropriate too.